This morning because the Archdiocese of Nyeri and Diocese of Kitui, we understand, are set to launch a distress call, actually a free toll number, as well as start an humanitarian fund. The event is expected to take place in Nyeri County this morning, and our reporter Ibrahim Karanja, based in Nyeri County, is keenly following up on this story very closely. He'll be joining us later on. But Masenda Muliro University in Kakamega town has started making sanitizers to be used to contain the spread of coronavirus. Let's speak to our reporter Willie Lusige for details. Willie Lusige, good morning. Kenyans are coming together fighting this COVID-19. Talk to us about the hand sanitizers being made by the Masenda Muliro University students.
Good morning, Brenda. Actually, indeed, Kenyans are coming together to put their effort and energy in combating the spread of the COVID-19. And what is happening here in Western region, because of the high population and also the high demand for these sanitizers and even chlorine, which is playing a key role actually in terms of fumigation. We've seen a different number of counties now fumigating major urban centers and marketplaces. There has been demand for chlorine, which is not easily available. It's not easy to buy from Nairobi and transport all the way to Western. So what has happened, Masenda Muliro University, which is the biggest university in Western region now, has opted to producing chlorine and sanitizers because the university is closed down and students were sent home because of the outbreak of COVID-19. So far they're producing more than 1,000 liters of chlorine every day, and a number of these sanitizers which are being distributed to hospitals, and apart from that also being issued out for free to the members of the public. But the biggest purchasers have been these health facilities, especially hospitals that did this, and other counties that are now fumigating major urban centers. But one of the biggest challenges they have been facing is lack of enough material, and apart from that also lack of enough facilities, because it's a new project that they are now trying to develop and to expand, but they have been playing a key role in the fight against coronavirus. But apart from that, Brenda, is very, very important to highlight now they are also turning their hostels into isolation and quarantine center in preparation if the outbreak will spread to Western and the number of patients increase. Most probably the hospitals will not be able to handle those cases. So what they're doing now, they're trying to set up a new COVID-19 hospital within the hostels that will now play a key role in what we can term as the best way to handle the number of patients if the number might go up, because there have been fears that most probably what the health officials here had speculated, maybe this month they had expected to have around 300 patients of COVID-19, but God has been good. We have only 2 cases that have been reported. So what they're doing, they're trying to be able to provide enough materials and sanitizer to the members of the public rather than to import or to buy these materials from Nairobi. Yesterday, and we visited there and we saw the whole process of how they're producing these sanitizers and even chlorine, and we filed the following report.
Kitakasa mkono chenye tulitengeneza hapa na tunaweza tengeneza vingi, lakini sasa uhaba wa bidhaa ya kutengeneza hiyo ndio inatufanya tusitengeneze mingi, lakini tukipata namna ya kutengeneza tutatengeneza mingi ili tuweze kusambaza katika mkoa huu.
Hapa ndio one of production unit yetu ya ambayo tuna produce products kadhaa zikiwemo sabuni, hand sanitizers and other products. Hii ni lab ambayo tumetenga kidogo kwa sababu ya COVID-19, ambayo tuseme kwa siku tuna produce almost 1,000 liters, lita 1,000 ya all the liquids. Tulikuwa na equipments kama mixer ni very important, na tukiwa na hiyo tunaweza produce per day, nafikiria hata more than 2,000 liters per day of liquids.
Maono yangu ni kwamba hapo mbeleni tutaweza kupanua huu mradi uwe mkubwa, tujulikane katika nchi ya Kenya kwa kutengeneza hivi vifaa na hivi vyombo ambavyo vinaweza kutusaidia kuzuia maradhi ambayo ni hatari katika nchi yetu. Kakamega hatuna moja, lakini tumekuwa katika mazungumzo na serikali ya county. Tutatenga mahali ambapo tutaweza kuita COVID-19 hospital, lakini mabweni yetu yanaweza kutumia kwa ile kiwango cha kwanza, isolation. ambapo watu wamewekwa katika rumu tofauti tofauti, wangojewe katika karibu siku 14. Kama watapata huo ugonjwa, basi tuelekee kiwango cha pili.
So Brenda will be following up to see if they'll be able to scale up the production of the basic sanitizers and even chlorine, and be able to see if they'll be possible to set up that new COVID-19 hospital in the fight against the spread of the COVID-19. Brenda.